A lot of patients will ask me, when they're kind of considering, who to see and who to trust, they'll ask me, well, Dr. Yates, how long have you been doing it? Why are you doing it? What's your philosophy of hair? Do you enjoy it? Or are you just here trying to do whatever? So my answer is the following. Everything that I tell my patients, I've done myself. That's number one, meaning that I've had a hair transplant. Before I had a hair transplant, I suffered probably since age maybe 21 with thinning hair, and kind of suffered in silence in that as you watch your friends who have a full head of hair and your hair is thinning and going back and your head's looking bigger and bigger, and you're just suffering looking at your friends like, oh my God, what's the matter with me? And you're losing confidence. Now you can't show that to the rest of the world, but inside it does hurt. So I know what people are feeling when they come to me and they say, hey, my hair is thinning, and they kind of underplay it. A lot of people underplay what's really going on, but I know exactly what's going on. It's hard to really stack yourself, I don't care how smart you are, you're the CEO, the SEO, or whatever you want to be of whatever company. It's still, you want to be all you can be, and you just feel like you're missing something that's out of your control if you start to lose your hair. And that's kind of how I felt, that everything else I could study, get great grades, be the best doctor, run fast, jump high, all those things I could do, but I couldn't do anything for my hair. So I know that feeling, and I know exactly what people feel. I've been doing hair now for about since 2005, so approaching 10 years. Before that, my medical career, I was in ICU, I was a trauma surgeon. I'm from the Midwest. I went to Northwestern Medical School. I was kind of in a hurry to be a doctor. When I was in high school, an unfortunate thing happened. My mother died from cancer when I was a sophomore in high school. So after that, I said, oh my God, I want to be a doctor, help cure cancer, things like that. So Northwestern had a program where you could become a doctor really quickly. Like from high school, you can do it in 6 years instead of the traditional 8. So I applied, they accepted me, and off I went to the races. Went to Northwestern Med School, really loved being a doctor. I trained as a trauma and an ICU surgeon, meaning that I was the surgeon that took care of all the sick people in the ICU, usually with GI problems or trauma problems. And I did that for approximately 10, 12 years. Then I switched over to do hair transplant surgery. Now, the reason I switched over, because the thing I didn't tell you, I had a hair transplant when I was a trauma surgeon. My hair was thinning so bad. One night I was watching a TV commercial and I saw an ad for one of these hair transplant companies. So I went there, had a transplant, and I couldn't believe how well that it worked. I couldn't believe how much better I looked, with just a transplant. So I was a firm believer in hair transplantation technology. So in 2005, I got recruited by a company to join their company to do hair transplants. I was a willing participant because, one, I knew the feelings that you have before one. Number two, I knew how well it worked. So since that time, that's all I do. I do hair transplants. That's all I do. That's all I specialize in. I'm a student of the craft. Every day we're trying to improve on what we did yesterday. Presently, what we do now is basically all FUE surgery. FUE surgery means follicular unit extraction, meaning instead of removing the hair from the back with a long cut using stitches, removing part of the scalp, we individually punch each hair one by one to get the amount of hair we need to do the job. We either do this with the assistance of the ARTIS robotic system, or I do it by hand. Either or, I think it's the best thing in the world, and I try not to do any strip surgery at all at this point. So our practice is, every year we're trying to get better. I mean, if next year there's something that looks and feels right as far as patient outcomes being better, trust me, I'll be on there trying that technology to make sure my patients get the best outcome.